Hmm. Now, we'll start with the next chapter. असात shalyaapanayaniya अध्यायं व्याख्यास्यामः यथोवाच कुर्वन्धनन्तैः तत्र समासेन अनवबद्धशल्योद्धरणार्थं पञ्चदश हेतून् वक्ष्यामः तद्यथा स्वभावः आचनं भेदनं धारणं पीडनं प्रमार्जनं निर्भापनं वमनं विरेचनं प्रक्षालनं प्रतिमर्षः प्रवाहनम् आतूषणम् अयस्कान्तः हर्षश्चेति. Now, the shalya, which is remaining in the body, which hurts the body, they are classified into two categories as anavabadha and avabadha. That's something which produces, which is difficult to be removed, or which is firmly fixed to the body, or which needs an emergency treatment. They are the avabadha shalya. Anavabadha shalya are those which are loosely held, and the physiological reactions and very simple procedures, which is not really a medical intervention, can be enough to manage. They are the anavabadha. So avabadha and anavabadha, that's the classification of these. In the present day situation too, in the present contemporary situation too, when we say that the foreign bodies in the body, we categorize into them two categories: emergent and non-emergent. Emergent in the sense those which are require an immediate intervention, and without medical intervention they cannot be handled. That's the emergent. Non-emergent, either where you can wait and watch, and many times it can be managed without a specific intervention. Now, to give an example, that's how it's categorized now in the present day situation. Avabadha and anavabadha is the emergent and non-emergent. The emergent examples of the emergent in case of the GIT, like a sharp or irregular shape, chemically active poisonous, have not mobilized in 24 hours. Like if there is a foreign, I think that's something which I just referred to in the previous session too. If there is a foreign body in the GIT and it has not moved in 24 hours, or if there is an obvious evidence of injury, or if there is a significant symptom of the obstruction, or in the respiratory conditions, if there is an airway obstruction, or if it is an absorbent. Now, an absorbent like a wooden or sponge material, it may get expanded later, like due to the absorption. As the object is swallowed in or aspirated in, the size may be smaller, but in due course of time, the size may increase, and such a substance has to be removed as early as possible. Patients who have a poor coughing reflexes, it needs to be removed, and penetrating injuries, if there is an object which can penetrate, or in similar ears which produces bleeding or a chemical irritant, or in eyes which cannot be washed off simply, or so on. So whenever there is a patient presenting with a foreign body, the first of the thing which you have to decide is whether it's an emergent condition or a non-emergent. In an emergent condition, it needs to be intervened as early as possible with the following the usual standard guidelines. If it is non-emergent, either you can wait and watch, or maybe allow have some simple protocols to remove them. Now, these protocols of the non-emergent conditions are where the possible body reflexes or simple procedures can produce a expulsion of the foreign body. Sushruta gives the examples like the swabhava. Swabhava is the natural reflexes. The examples given by Sushruta for the swabhava are तत्र अश्रु क्षवतु उद्गार कास मूत्र पुरुष अनिलैः स्वभाव बल प्रवृत्तिः नयनादिभ्यः प्रदति. Like the ashru, the tears. Now, tears or the lacrimal glands are meant to protect the eye from the possible foreign bodies getting into the eyes, and it's a continuous protection. A layer of tears would always protect the conjunctival surface and allows for this clearing of the passage continuously. If there is a small, minute object like a dust piece gets in, it gets expelled out spontaneously with the tears. So tears are the protective reflexes. Only when the tears fail to remove that object, then you go for the interventions. That's the idea of when we say swabhava as a method of anavadha shalyaapanayaniya. The others are the kshavatu and kasa, the cough and sneezing, very important reflexes in the body. Cough and sneezing reflexes are again primarily the reflexes meant to clear the respiratory passages, but there is a important physiological differences between the cough and the sneezing reflexes. Cough reflex is when there is a irritation of the larynx and the lower respiratory tract, whereas the sneezing is when there is a nasal mucosa is or the nasopharynx is inflamed, or there is a irritation of that either with the secretions or with any of the foreign body. The cough is regulated by a coughing center at the base of the brain, whereas the sneezing reflex is a lower spinal cord reflex. It's regulated at the cervical segments. Cervical second and first and second segments are the segments where the reflexes are generated, and hence the whole reflexes of the sneezing is totally involuntary, whereas coughing there is a partial involuntary as well as voluntary. To a certain extent, the coughing reflexes can be suppressed or evoked voluntarily, whereas at times it can become involuntary. Then the nerves which regulate these coughing is mainly, I am not saying one, it's mainly the passage of the impulses of the coughing downwards towards the muscles is the vagus, whereas the trigeminal is the main nerve, major nerve, which regulates the sneezing reflex. And when the cough occurs, the glottis is closed and it opens suddenly, and hence there is a sudden change in the pressure, so it's more effective than sneezing. In the sneezing, the glottis remains open, and hence the total amount of the pressure produced is lesser. The muscles which are active in case of the coughing are expiratory muscles are involved, whereas in case of the sneezing, respiratory muscles are less involved. It's mainly the abdominal muscles which push the contents out. So that's about the basic reflexes. And depending upon the location of the inflammation, these reflexes are generated. Sushruta even includes Mutra Purisha Anila, the urine, the feces, as well as the flatus, as the means of expulsion of any of the irritant objects. Of course, it's absolutely true. A minute crystals in the urine or any other object which could be expelled out from the gastrointestinal tract can be expelled along with the feces as such. That's about the Swabhava as a means of anavabadha shalyaapanayaniya, or a minimal intervention mode of removal of the foreign body. When the shalya is located in the deeper plane of subcutaneous area, Mamsavagadam, Shalyam, Avilashyamanam, Patayitva, Prakota, Tasya Puya Shonjavega, Gauravagva Padati, Pakvam, Abhidyamanam, Bhedayet, Darayadva, Bhinnam, Anirasyamanam, Pidani, Pidayet, Panibhirva. Now, Pachana, Bhedana, and Dharana, or Pidana. Pachana, Dharana, and the Pidana are the three protocols which can be used in case of the shalya which is located in the subcutaneous area according to Sushruta. Now, suppuration or formation of a pus from the current surgical point of view or current medicine point of view is always considered as a complication, is never considered as a sequelae or a possible termination of the disease. Whereas from Ayurvedic point of view, pus formation can be controlled. The Pachana Chikitsa is a unique idea of Ayurvedic concept where a controlled separation is possible and is used as a termination of the disease. The disease can be terminated and is considered as a sequelae of the injury. Now, the controversy whether which is right, which is wrong, and that can be debated for a long time. But anyway, there is a primary difference. But practically, it's one of the body's natural reflexes. Whenever there is a source of irritation, one of the possible termination of the inflammation would be the suppuration, and suppuration is always considered as a termination. Of course, you have the other terminations of the inflammation like calcification, fibrosis, etc. Calcification and fibrosis would always result in a permanent stigma, evidence of the disease throughout the life as such, whereas the suppuration would have a termination. There will be no more evidence of the disease once the whole tract is healed. So that's the difference. Now, whether suppuration has to be considered as a sequelae or not, for the debate point of view, if at all it's going to the debate, a higher level debate, that's the issue. Anyway, we will not go much beyond that. But Sushruta considers that Pachana Chikitsa, the protocols of Pachana, how to achieve that Pachana, they are mentioned in the Shastropakrama Chikitsa. So once that pus is formed in the superficial area, you don't have to use a incision. See, when you make a knife, you make use of a knife and make an incision, that becomes a surgical procedure, and that becomes a treatment for the avabandha shalya. But if it is allowed that pus is made to flow out by applying some layer pus, which can produce a squeezing effect, and it falls off spontaneously, then it can be considered as a dharana. So once the pus is formed, the pus may end up in a spontaneous expulsion. So whenever there is a pus formed in the body, pus always has a natural tendency to reach out to the area where the resistance is lesser, so it may get exposed to or expelled out to the exterior of the body, or accidentally, occasionally, it may get into the viscera of the body. When it gets into the viscera of the body, that becomes an emergent condition and is in the deeper situation. Whereas if it is in the surface and it is going to be expelled out to the exterior, that's considered as a natural sequel, and hence Sushruta has considered that option in case of Mansavaghata Shalya, superficial located Shalya only, that you induce the separation and along with the pus, whatever that source of irritation may get expelled out spontaneously, or it may be facilitated to get expelled out by a dharana, applying of a squeezing leper, or it could be manual squeezing, just compression around the area, pidana. So pidana is a manual compression, dharana is a compression produced by applying some drying leper, dry leper is applied. Now, the other protocols of that Anabhadushalya are Anuni Akshasalyani Parishechana Adhnapanihi Bala Vastrapanibihi Pramarjayat. The minute shalya or foreign bodies getting into the openings of the body. Aksha are not simply in there, openings of the body like mouth, nose, etc. They can be removed by pouring some liquid, Parishechana, or Adhnapana, blowing out, or Bala Vastrapanibihi, make use of a hair or a cloth, or with the hands they can be removed or just strapped off. Pramarjana is strapping is the technique. So that's one protocol. Of course, it's a very common thing which is done regularly. Then ahara shesha shleshma hina anushalyani shasana utkasana pradhamani nirthamita. If there is some residual food substance which is located somewhere in the oral cavity, or and then produce the irritation, or maybe in the nasopharynx, it could be expelled out by either coughing or having some regulated breathing, or maybe blowing out. Again, something which is done regularly. Anashalyani mamana anguli pratimasha prabhutivihi. If there is a residual food substance located deeper uh, uh, in the distal part of the pharynx, or very close to the esophagopharyngeal junction, not cross to the esophagopharyngeal junction, it can be expelled out by inducing an act of vomiting by touching the palate. So you induce a vomiting reflex or pratimasya, nasya, so that a sneezing is induced. So induced sneezing. The difference between that swabhava and the pratimasya is that the swabhava is naturally acting, naturally occurring sneezing. In the pratimasya, you induce that sneezing by putting the drops or the nasyas into nasya dravyas into the nose as such. Vamana, the reflexes of vomiting also, when it becomes vamana as a natural phenomena, that's a swabhava. And when it's induced by touching the palate or so on, it becomes again the one of the methods of intervention as such. So there is a difference from the point of view of the anabadha shalyahranopaya. Then virechanehi pakvashagatani, a mrudu virechana can be done to remove the shalyas in the distal part of the gastrointestinal tract. Something like the usual given these laxatives, etc., without any specific protocol. Now, when I say Virechana and Vamana in this context, it's not about the protocol of Vamana and the Virechana Shodhana Chikitsa, where you give Snehana and then go for the protocol. It's just induction of the expulsion. That's the idea. So, and when it becomes that kind of a protocol where you use all the Puro Karma, Pradhana Karma, and then go to the this treatment, that's a protocol used for Avabadha Shalya Aharana, where the doshas are removed, whereas a simple foreign body, some object which has got in and then it has to be expelled out, then it's simply a inducing of vomiting or inducing of the purgation by protocol is administering such specific drugs or specific techniques without that protocol of the Purakarma. That's about the Anavabadha Shalyaharanopaya present for the gastrointestinal tract. the protocol of dealing with the foreign bodies in the gastrointestinal tract, I think we have discussed that in the previous session. Again, I'll repeat. The idea is the first of the thing is you have to decide about whether that foreign body has a possibility of injuring the body or not. Injury could be physical injuries like where there could be sharp surface, or it could be chemical like if it's irritant. Then there is no choice. It has to be removed as early as possible. If it is a chemical, you have to think of whether it can be neutralized or not. Instead of going for neutralization, diluting with water is always a better option in case of a chemical consumed by the gas consumed into the gastrointestinal tract. Then, if it is a relatively non-sharp one and it's not going to harm, then if you have to watch and observe, as we have discussed earlier, any substance which has crossed the pharyngoesophageal junction has a fair chance of getting expelled out spontaneously. If it has crossed the pyloric junction, then you are almost sure that it gets expelled out, provided there are no other structural abnormalities. In such situation, you have to watch and then observe. Only when it's not moving or it remains stable for more than 24 hours or more than 48 hours, there are two sides of the protocols, then it requires some intervention. That's the usual standard protocol of dealing with foreign bodies in the gastrointestinal tract. Then another is Brana dosha ashayagatani prakshalani. Douching or washing with the water or any liquid forced in could be in case of the wound or any other cavities. If a foreign body presented in the cavities, it can be washed off with the douching. Vatamutra Purisha Garbhasangeshu Pravahanam Uttam. Pravahanam, straining downwards, would be useful to expel the fetus, Garbhasanga, or Purisha or Vata Mutra, fecal material or the fetus urine also. Now, when I say this, it doesn't mean that in every condition where there is an obstructed labor, straining would be enough. But many of it, early stages, it can be facilitated. That's all. It's a sort of facilitation of a normal labor by the straining. But it's not that you continue with the same till the end. If there are any signs of distress, then you need to have other level of intervention. So your approach has to be next level. So idea of this Anavabadha and Avabadha categorization is to grade your response, either a moderate or mild this response, and awaiting a natural ending of the disease difficulties, or you can go for the intervention. So being prepared for that intervention and continuous observation is the basic gist of this this classification. Martha Udaka Savisha Rudhira Dusta Stanyeshu Atusharam Asyana Vishanaiva. If there is fluid collected, either it could be fluid collected in form of the breast milk, you can have that breast milk suction, or in case of the poisonous conditions too, suction is suggested by Sushruta. Now, how far it is useful, questionable. There is always, if there is a poisonous bite, and instead of attempting for the suction, it's better to wash off the present situation. Anyway, that's the point as it. Then Udaka, if there is excess of water somewhere in the gastrointestinal tract or in the respiratory tract, like drowning, and it can be expelled out by suction. So suction is done regularly in even the ward if there is a respiratory obstructions or the sputum which is obstructing the respiratory tract. So such of those protocol where you use a suction or Vishaneva. In social spirit, it could be the horns of animals, it could be used for suction. Now you have a suction machine now. Anulomam anavadam akarnam analpa pranamukham ayaskantena. Ayaskanta or a magnet is used to remove a shalya which is over the surface, located over the surface, and where direct handling with an instrument is not necessary. The important is that in the present day situation, in every industrial hospitals, there is a need to have a ophthalmic foreign body extractor which makes use of static electricity, and particularly this is used to remove the object which can get into the eyes. Very simple procedure where instead of a magnet, a static electricity is produced so that even a non-metallic object can be expelled out. The advantage of this would be there is no need of any intervention any instrument coming into contact with the surface, simply because of the magnetic force, the object can be expelled out. And particularly now, in every industry where there is soldering and the welding works done, this instrument is mandatorily kept as such as a first aid measure, and is used to remove that. And that's exactly what Sushruta has said about Ayaskanta. So when Sushruta suggests about Ayaskanta, a magnet, we need to appreciate that technological skill and then that ideological development, the development of that technology, particularly that intellectual capacity to think of that options has to be appreciated. Then Hriti Avasthitam Aneka Karanotpannam Shokashalyam Harshena iti. Another very important is the Shokashalya. Grief which is hurting anyone can be managed with some other diversion of the mind, Harshena. You do some pleasant activity and it can be used as some candidate who has failed in the examination, taking him to the party can help in reducing the distress as such. That's about the Anavabadha Shalya. The next part is about Avabadha Shalya. When the Shalya are deeply situated and we need to have intervene, and certain of those protocols of intervention, very important and very practical, absolutely practical, even in the current surgical practice, they have a relevance, and hence we need to have a thorough discussion of this. Now, सर्वशर्याणां महतां अणूनां द्वावयव आहरणहेतु भवतः प्रतिलोमो अनुलोमश्च. तत्र प्रतिलोमम् अर्वाचीनम् आनयेत् अनुलोमं पराचीनम्. There are certain general rules of dealing with a foreign body which is fixed into the body. It can be expelled out by antegrade or retrograde techniques. Antegrade is if there is a nail, either you can push that object further or pull back. That's retrograde. Antegrade is it's removed in the same direction as it has got in. Now the option is depending upon the depth of penetration and all the other calculations. Like suppose if there is a nail which has hit and then it has crossed almost more than two-thirds of the length, if it doesn't have a wider portion of this ending, if you can cut that, you can just pull it out in the same direction. Or if it is a bullet which has hit into the body, and if the bullet has crossed up to the area, suppose if a bullet has hit in the point of entry and it has reached up to this point, instead of attempting to pull that bullet back to the same track, it's better to make an incision and then remove it out. Whereas if it is the other way, if the object has just crossed in and then there is a wider end like a nail, then it's better to pull it back. So this kind of a decision is made out by considering the possible collateral injury during the protocol. A bullet which has crossed up to the surface, suppose a patient comes with an injury and that the bullet is seen on the surface, it's better to remove it from by making an incision instead of attempting to pull it out. But if the bullet is located very close to the surface of entry, point of entry, it's better to pull it back. So that's how it has to be removed. And it's true for any other foreign body, but there you need to have a proper assessment and the possibility of the collateral injury, possibility of further injury during the procedure has to be considered, and then the correct option has to be taken in. So either it has to be removed retrograde or antegrade. That's the idea. Now I'll give some more examples of the same, quite practical examples which you can see. Like suppose a patient has come with a fish hook, which is again quite common incident, a fish hook pricking into the fingers. So suppose the fish hook has gone in partially, just located at the area, it's better to remove in the opposite same area or just retrograde, pull it back, and important is you have to follow the pathway of the entry instead of pulling it straight up. It has to be directed, the curvature has to be followed by tying a thread and then just pulling it in the curved direction. Now tie a thread and give a vertical pull and then with one hand compress down so that the curved path can be negotiated in, and then it has to be pulled out. That's the idea. Suppose if it has gone deeper, much deeper, and has crossed in, then instead of that direction with the thread, you just push it directly from the fingers and then pull out. So the important is you need to follow the pathway as such without producing further collateral injury. Suppose if it has gone much deeper and you have the other end also seen, then better to cut it off at this end and then pull out in the same direction. So this is an example of the rib antegrade, the same direction of entry, you have to remove it. So choice is based upon your experience and the shape of the foreign body and the possibility of a complication later. Now, when you remove this and handle that, another important thing which you have to consider is the shape of the foreign body. If there is a sharp or a cutting surface or injury, possible injury to the tissue as the exposed part is negotiated, that part has to be cut off. Uttunditam chitva nirghatayet chedaniyamukam. Altering the shape of the body, foreign body, and making it safer is another very important technique of removal of the foreign body. Like the simple example of a fish hook, as I said, instead of removing the fish hook integral, you cut it at this end and then pull out or maybe push out. So when you cut this here at the sharp edge and then pull out, the possibility of the injury is lesser. The chedaniya mukha has to be cut off. That's the technique. Of course, in the current surgical practice, you have many such examples. One of the very common situation and best example is in case of a safety pin which is swallowed in. Suppose a safety pin is swallowed in and it is remaining open. A open safety pin has a sharp penetrating point and it's dangerous to keep it in. So instead of attempting to remove that safety pin as such, with the endoscope, you can attempt to close the safety pin. Once the safety pin is closed or locked, it is safer. And the size of the safety pin is such that it can be expelled out. Either it can be expelled out or it can be pulled back safely without producing the injury. So this way, the technique of modification or altering the shape of the body, foreign body, in such a way that the injury is minimal is one of the advanced concept, and the original idea of that kind of advanced concept is from Sushruta when he says Uttumnizam Chitva Nirghate Chedaniyam. Now, Chedaniyam Khanyapi Kukshu Vaksha Kaksha Vamsha Parshukarantara Pratitani Hasta Shakyam Yatha Margena Hasteneva Abhartum Prayateta. Whenever there is a sharp object and a slight movement can produce more injury, it's better to use the hands directly instead of using any instrument. This is what Sushruta says. By using the hands, the chances of extra movements would be lesser, and hence the possibility of injury would be lesser. When you use any instrument, then that can produce more movement. This is what Sushruta has said. But now, in the present situation, we have many precision instruments. Some of the precision instruments which can fix the object in the beginning, and then after the object is fixed, then it can be pulled out. So choice of whether you use the hand or the instrument is depending upon the availability of a particular instrument and your capability to deal with that instrument. Suppose if your hands are not very steady, if you have tremors like, then it's better to fix with an instrument and then pull out. So that choice is left over, but the basic principle is the possibility of an injury to the body or extra injury during that technique should be minimized. Hastene avahartum shakyam ashakyam vishasya shastrena yantrena abharet. If it is cannot be removed with the hand, if it cannot be held with the hand because of the size or maybe the shape, then in that condition you may fix with an instrument. This is what Sushruta says. In the present day situation, of course, the principle is the same, but only the difference is you have certain precision instruments which can be some considered as better than the hands at times at some situations. Now, another important protocol which Sushruta had considered is about making the patient, saving the patient from the possible this neurogenic shock during this handling. During the handling of the body, this wound or any of the foreign body, there is a possibility the patient may go into a neurogenic shock, and you have to observe and then resuscitate the patient. For the resuscitation of the patient, Sushruta has suggested to make use of cold water. Sheetalena jalenena murchandam avsechet samrakshet asyamarmani muhu ashvasechatam. So resuscitation of the patient is another of the part of the protocol. Now, of course, in the present day situation, when you have the facility of anesthesia, this may not be a a responsibility of the surgeon. It could be a responsibility of the anesthetist. You can hand over that responsibility to the anesthetist now of maintaining the patient's vitality and resuscitation whenever necessary. In Shushra's period, because anesthesia facility was not there, surgeon had that responsibility of keeping the patient alive and ensuring that the patient doesn't go into shock during the surgery. Now, once the shalya is removed, then तथा शल्यम् उद्धृत्य निर्लोहितं व्रणं कृत्वा स्वेदाहम् अग्निघृतप्रभृतिभिः संसेव्य अवदह्य प्रदिश्य सर्पिर्मधुभ्यां बद्ध्वा आचारिकम् आदिशेत. Now, after the removal of the shalya, you have to ensure a hemostasis. There should be no fresh bleeding or frank bleeding. And if at all there is a necessity, you may use agni or ghrita or sweda. So that depends upon whether there is a necrosed tissue and it has to be debrided or not. If there is a need for debridement of the tissue which is not viable, so the next part is you have to confirm whether the edge of the wound and surface of the wound has a non-viable tissue or not. If there is a non-viable tissue, you have to remove it. Only the viable tissue has to be left over. And then you should suggest to apply sarpi and madhubhyam, sarpi and madhu, ghrita and honey has to be applied. Now, of course, you may use any other antiseptic substances and then put a bandage. Badhva acharikam upadesheta. That wound has to be taken care of as you treat any of the wound. Now, शिरस्नायुविलग्नं शलाकाटिभिः विमोच्य अपनयेत् श्वेतु ग्रस्तवारङ्गं समोपीट्य श्वेतुं दुर्बलवारङ्गं कुशादिभिः बद्ध्वा. Now, certain of the additional precautions which you can take is, if an object is in between the fibrous structures like tendons and ligaments, then the fibers of the tendons and ligaments have to be carefully separated with a probe or a specific rod-like instrument, and then this object, foreign body, has to be removed so that there will be minimum tear of the fibrous structures. Or if there is a swelling edema in the area, that edema can be reduced by compression. As in case of paraphimosis, we do that. In paraphimosis, the edema can be reduced by compression over the area, and then the paraphimosis can be reduced as such. Durbalavarangam kushadibibagga. Suppose there is a possibility of breaking of the object during the handling, it's better to tie them if at all possible and ensure that none part of the object is not left over. Then hृदयम् अभितो वर्तमानं शल्यं शीतजलाद्व्येचितस्य अपरहेत् यथा मार्गं दुर्पहरम् अन्यतो अपबाध्यमानं पाकयित्वा उद्धरेत्. When a object is close to a vital organ like heart or so on, and your movement of that foreign body can produce more injury, a blind handling can result in more dangerous complications. It's better to have an open wound, cut the area around and expose. Now, suppose if there is a foreign body like nail is in a crucial area, like very close to a blood vessel or a heart, organ like heart or so on. Now, particularly, very commonly you will see such situations where the object is very close to a artery or a nerve or so on, and it has not yet penetrated that. Then, instead of handling it blindly, it's better to make a wide incision around and reach up to the base, examine the area, like which are the other collateral injuries, and pull out so that the tissue which is not yet injured is safer, and the undue mobilization of that object is doesn't produce further more injuries. This is the protocol which is followed even now, and it's applied to any of the object where the terminal portion or the edge of, terminal portion of the object is not visible and it's close to a vital organ, and that vital organ is not yet injured. To prevent that, you may use this kind of protocols. That's exactly what Sushil says. Dulpahara anyato apavadhyamanam patayitva uddhareta. Then astivivara pravistam astividastam vagrahya आदाभ्यां यन्त्रेण अपहरेत्. अशक्यम् एवं वा बलवद्भिः सुपरिगृहीतस्य यन्त्रेण ग्राहयित्वा शल्यवारङ्गं प्रविभुज्य धनुर्गुणैः बद्ध्वा एकतश्च अस्य पञ्चाङ्ग्याम् उपसंयतस्य अश्वस्य वक्त्रकविके बध्नीयात् अथयनं कषया ताडयेत्. यथा उन्नामेन शिरः वेगेन शल्यम् उद्धरति, दृढां वा वृक्षशाखाम् अवनम्य तस्यां पूर्ववत् बद्धः उद्धरेत्. Now, You may come across that kind of a situation of casualties of injuries with some foreign bodies anywhere. It may not be in a hospital setup where you do not have all the where you may not have all that facilities there. So instead of waiting for the facilities or instead of not handling a patient without that sufficient infrastructure, you make use of whatever is available in the surrounding area and survive, make the patient live, survive. Now, in 1975, a person called Marx was given a award, national award, Max's award, for saving the life of a co-passenger in the flight. The situation was that the incident is a co-passenger had swallowed some sticky substance, sticks, and it had blocked the respiratory tract. It was just blocking the respiratory tract, and he was choking like. And the person, this Marx, he opened the larynx. He did a tracheostomy with the cake knife, the knife which is going to cut the bread in the flight. With that knife, he did a tracheostomy, and till the patient, the flight landed into some other area, and a hospital facility was available. He kept the patient alive, and to make for making use of that kind of a situation where a knife used for cutting the bread was used for tracheostomy, he was given that Maxwell's award for that spontaneity. So spontaneity in medicine is one of the important issue which can save the life of the patient. See, medicine to consider in a hospital setup where you have every facility is one way, and treating a patient in a situation where you do not have any facilities and making use of the natural resources is the other way. And this aspect of the medicine where you make use of whatever the sources which are available and having that spontaneous reflex is one of the important reflex activity which cannot be taught in the textbooks. And that spontaneity is always an essential part of the surgical practice. Now, Sushruta gives the example of the spontaneity here. Now, if there is a foreign body which has got into the bone and then cannot be removed easily, see, easy removal is not possible. And this is true in case of the warfare situations of Sushruta period, like an arrow which has gone in and then has firmly fixed to the bone. You may pull it out with your hand. If it cannot be pulled with your hand, you may just ensure that the patient's leg is kept firm with your leg. Your leg can be used to enhance the strength of the hand, and the leg giving that stabilizing force, and with the hands you can pull out as such, or make use of any of the instrument which is available there. Now, if there is no such instrument available there, then in a war field, now this is true in case of a war field of Sushruta, there could be a stray horse which is just moving around, or at least a horse with that, the person who is dealing with that. Now, tie the foreign body to the horse's seat and keep the patient fixed with some strong persons and beat the horse. Now that horse power, the strength of the horse is used to remove the foreign body. Now you use many machines in the operation theatre, and the strength of the machine is a measure in horsepower. Sushruta had made use of the horse to remove the shalya object and asset. So idea of horsepower and horse, real horse, that's the difference. Anyway, that doesn't mean that you have to bring a horse to the operating theatre, but it's only in such critical situation where you do not have the other facility, make use of the resources which are available. Suppose even the horse also is not available, you have the other means. If there is a tree and the branch of the tree is very close by, bend the branch of the tree, then tie that bent branch of the tree to the arrow and then release it suddenly. And when you release suddenly, ensure that the patient is not just pulled out along with the branch. Now, this kinetic energy which is released by that release of the branch can help in removal of the shalya. So, these need not be considered as an issue of joke or criticism, but you need to appreciate the spontaneity of Sushruta, and that's what which has to be highlighted in these examples. Now, Adeshu Tumitam Asthila Ashma Mudgaranam Anyasamasya Praharena Vichalya Yathamargam Yantrena. If there is such a situation where even simple handling would not be enough, or if it is firmly fixed, you can mobilize mobilize them by making use of a hammer or maybe a stone piece or so on. So mobilizing that object is necessary. You do that if you can save the life of the patient. Now for the mobilization, now you may use some sophisticated instruments, whereas Sushruta had used a stone or maybe hammer or so on. Even in the orthopedic surgery, even now we make use of hammers and so on, but not in the theater with controlled situations. Then Vimrshita Karnani Karavanti Anabadakara Deshotunitani Purastadeva, that altering the shape of the sharp surface is another issue. If there is a karna, that's a sharp surface in the arrow, that sharp surface has to be modified. Shape has to be modified by compressing it and then remove it. That, like the example of safety pin which I said, or maybe as you see in a practical situation, this is one of the real story where a rod has gone into the skull and the patient was still active and in a conscious state, and this rod had to be removed. To remove the rod, the same issues. With the X blade, that rod was cut and two ends, and then it was pulled out, and you have that reference of that issue even. Now, some more of this very intelligent method of removal of the shalya. जातुषे कंठासक्ते कंठे नाड़ीं प्रवेश अग्नितप्तांत शलाकां तथा अवगृह्य शीताभिः परिशिच्य स्थिरीभूतं शल्यम् उद्धरेत् अजातुषन्तु जतुमधुत्यश्च प्रलिप्तया शलाकया पूर्वकल्पेन इत्येके. Now, if there is a toy, and in those days the toys were either made of wax or non-wax. Now you have plastic or non-plastic. Suppose if it is a wax toy which had gone into the respiratory tract or maybe the throat, and it's blocking the throat, and it cannot be directly pulled out with the hand, then Sushil says to make use of a tubular instrument, nadi, a endoscope or a pharyngoscope, like a tube has to be kept in, and you heat a rod, and with the over the heated rod, you touch to the waxy material, and that waxy material will dissolve as it comes into contact with the heated rod. Wait till it gets cooled down. Now that molten wax will be firmly held to the rod. Now you gradually pull out. So this way, of course, this kind of a situation or technique is possible in case of plastic material now, but now we have more sophisticated tools, and hence you may not really use a heated rod, but attempting to melt that plastic and then removal is still possible. Ajatashantu, suppose if it is non-wax material, Sushruta says, like over the heated rod, you put a drop of wax, and that molten wax is used to fix the gums. Now we have some plastic gums, quick fix like gums, which can be used for such protocols. Rarely such techniques are used now, but still it's relevant. It's not irrelevant, though it may not be directly heated rod, but now you have the these adhesives, different sorts of the adhesives which could be used and which are used regularly. Then अस्थिशल्यम अन्यद्वा तिर्यक् कंठासक्तम अपेक्षा केशवन्दुकं दृढैक दीर्घसूत्रबद्धं द्रवभक्तोपहितं पायेत् आकण्ठात् पूर्णकौस्तुभं च वामयेत् वमतस्य शल्ये एकदेशसक्तं ज्ञात्वा सूत्रं सहसा तु आक्षिपेत् मृदुना वा दन्तधावनपूर्तिकेन अपहरेत् प्रणुदेद्वा अन्तः क्षतकण्ठाय च मधुसदृशी रेणुं तैच्छेत् त्रिफलाचूर्णं वा मधुशर्करा मिश्रम्. If there is a foreign body which is located somewhere in the upper part of the gastrointestinal tract, like maybe the esophagus or in the stomach, Sushruta suggests another of the technique. You tie a bunch of hairs to a thread and make the patient swallow, and the once that tuft of the hair goes into the area where that object like a bone piece or some other solid material is there, and if it gets entangled with that hair tuft, then once it gets entangled, you pull it out. Of course, practical difficulty would be to know when it has got really entangled in. So using some net-like substance, net-like instrument to remove the object is the basic principle. Now, in the present day situation, we make use of similar instrument, not tuft of hair, the Darnier's basket to remove the stones in the ureter. Now, Darnier's basket is having a similar network of fibers, these wires at the tip, and only thing is it can be regulated. It can be either pulled out, closed, or open. Now, you pulled out situation that instrument is negotiated to the distal end of the stone. Now, this is mainly Darnier's basket is used mainly to remove the stones in the urinary system, and then once it reaches to the distal area, open this net, and then as pull out, that stone gets entangled in. Now, of course, you have a control, USD control, to confirm whether it's there or not. Sushruda's instrument didn't have that kind of a precision protocols, but now you have that precision protocols, and it's safer. It increases the safety, but important is the basic principle, the basic concept of making use of a network-like substance to hold the object and pull out is what Sushruta has suggested. Now you have more sophistications which ensure the safety and precision. उदकपूर्णधरम अवाक्षिरसम अवपीडयत ध्वनियेद वामयेद वा भस्मराशो वा निखनेत आमकात. In a patient of drowning, when there is water which is in the respiratory tract, it can be expelled out by compression of the abdomen and the the usual protocols of expulsion where you have to compress the chest. Now, similar compression also would be required if there is a food substance which is intact, which produces the choking. Now, in patients of choking, ग्रासशल्ये तो कंठासक्ते निश्चंकम मनोबद्धम स्कंदे मुस्सिनाभ्यन्यास स्नेहम मध्यम वा पानीयम वा पायेत. If there is a food substance which chokes into the respiratory tract, again it can be expelled out by making the patient bending forwards and beating over the back, so that they will have this flow of air, sudden just flow of air, and it can be expelled out. Now you in the if you go into any five-star hotel, and in the five-star hotel in the dining room, you will have this kind of photograph scene which is called as Hendrix maneuver, which is a first aid in case of managing the patients with the choking. And that managing choking could be, if there is a choking, somebody has to, the person who can assist has to stay in the back and put a compression, beat the abdomen. That compression over the abdomen is required, and that pulse of air, flow of air, can expel out, and this is the protocol which is done. And what Sushruta has said is exactly the same of dealing with the patient's assets. बाहुरतिलोताकाशे कंठपीडनात् बाह्यप्रकृतिः श्लेष्माणं कोपयित्वा स्रोतो निरुणद्धि लालास्रावं फेनागमनं संज्ञानाशं चापादयति तम अभ्यद्य संस्वेद्य शिरोविरचन तस्मै तीक्ष्णं विदध्यात् रसं च वातकनं दद्यात् इति. If there is a asphyxiation, the compression of the respiratory tract, the major issue could be the aspiration of the saliva later, and hence the saliva has to be clear. If there is a total asphyxiation, that could be sudden death, that's another issue. But a partial asphyxiation and the patient has survived, then in that condition you have to ensure that the respiratory tract is clear by this aspiration or the suction as such. Now, whenever you come across a patient with the respiratory tract obstruction, the protocols which we have to follow is to decide whether it is a complete obstruction or partial obstruction. If it is a complete obstruction, then immediate surgical intervention is needed, and you have to confirm that by examining the patient. So the clear-cut examining is the patient is necessary, or careful examination of the patient is necessary to confirm that complete obstruction or partial obstruction. If there is a complete obstruction, the respiratory muscles will not be able to contract fully. Whereas if there is a partial obstruction, then the same protocols of expulsion can be tried as such. Now, the conclusion is भवन्ति छात्रा शल्याकृति विशेषांश स्थानानि आपेक्ष बुद्धिमान् तथा यन्त्रपृथक्त्वं च सम्यक् शल्यमथ आहरेत कर्णवन्ति शल्यानि दुःखाश्रयाणि यानि च आदजीत विषक्तस्मात् तानि युक्त्या समाहितः एतैः उपायैः शल्यं तु नैव निर्याप्यते यदि मत्या निपुणया वैद्यो यन्त्रयोगैश्च निष्हरेत् शोथपाकौ हृदयश्चोग्राः कुर्यात् शल्यमनाहतं वैकल्यं मरणं चापि तस्मात् यत्नात् विनिर्हरेत्. So a person should be aware of all the possible shapes and the possibilities of the shalyas, like their functionalities, shapes, and physical and chemical property of all that foreign bodies. And you also have to know about the techniques which are available or the instruments which are available, and you have to have a skillful handling. That skill and experience is one of the important issue in dealing with the shalya, and then only it can be successful. If a shalya is not removed, it can result in shotha, paka, edema and suppuration, severe pain, or even deformities or death also can occur, and hence all the shalyas have to be removed carefully. इति सुश्रुतसंहितायां सूत्रस्थाने शल्यापनयनीयो नाम सप्तविंशतितमोऽध्यायः. Classification and methods of extraction of foreign bodies is elaborately described in Sushruta, and many contemporary techniques are seated in this principle. With this, we'll conclude. If there are any questions, then try to answer, and then, right, there are no more questions. Fine, we'll conclude today.